Our next speaker who's up is Dr. Steve Broglio. Dr. Broglio is a professor of kinesiology in physical medicine and rehab at the University of Michigan, and he serves as the content lead in the area of sports-related concussion here at the University of Michigan Prevention Center. He completed his training at the University of Georgia and took his first faculty position at the University of Illinois at Urbana-Champaign, and he has been at the University of Michigan here since 2011. Here he directs another one of our sister centers, the Michigan Concussion Center and the Neurotrauma Research Laboratory, where he oversees center operations and conducts multidisciplinary research aimed at fundamental questions around concussion prevention, identification, diagnosis, management, and outcomes. As a reminder, Dr. Broglio's presentation is pre-recorded, but he will join us for a live Q&A following his presentation. And please type any questions you have during the presentation into the Q&A box so that we may ask them afterwards. Please join me in welcoming his talk.
Morning. Thank you for the opportunity to come and speak at the Injury Prevention Center online conference today. My name is Steve Broglio. I'm director of the Michigan Concussion Center. I'm also served as the Associate Dean for Graduate Affairs in the School of Kinesiology here at Michigan. I'm going to talk about concussion prevention and management as a way to make sport participation safer today. I have three primary topic areas that I want to touch on relative to some of the work that we've been doing. One is around the measurement and outcomes of concussion. So how do you evaluate and what's the best way to do it? What are short-term outcomes? Impact biomechanics. We've done a series of papers over the last 10 years or so looking at impact biomechanics in high school football players and what does exposure look like? What does injury risk look like relative to those individuals? And then lastly, looking at recovery trajectories. How long does it take for the average athlete to recover from the injury? What about different subgroups, people that show up with previous injuries that are being evaluated now? So if we think about the measurement and outcomes, our first topic, the one thing I want to make sure that's clear is that concussion remains a clinical diagnosis with no gold standard assessment tool. So you cannot take an individual to the hospital for a specific blood test, for an X-ray, MR, CT, anything like that. It's the impression the clinician has of the patient that allows them to diagnose the injury. And this certainly makes it pretty challenging. There's a lot of subjectivity that can happen around it, especially as you can imagine making snap decisions on the sideline in the middle of an important game on national TV and those types of scenarios. So we've done a reasonable amount of work in this space trying to understand what is the best way to approach it, what tools can inform this clinical diagnosis and give the clinician the best tools or best information possible. And we have largely centered around symptom evaluation, so asking, do you have a headache, nausea, fatigue, vomiting, those sorts of things. Is their balance impaired? Neurocognitive functioning, can they remember a series of words or shapes and doing different mental math tasks? And the vestibular function is actually one of the newer assessment tools that we're using now and seeing pretty good results in that space. And what we have found is that no single one of these tests provides the clinical sensitivity that we need, sensitivity and specificity that we need to be used in isolation, but the combination of these four or three of the four really provides a good amount of information to the clinician that will allow them to make an informed decision. Relative to outcomes, these same tools can be used to help track injury recovery. And what we're seeing is that the average individual takes about 10 to 14 days to recover. And this includes their time from injury until they indicate they no longer have concussion-related symptoms, as well as a graduated return to play process where they're slowly progressed back into their sport over 6 or 7 days. I'll touch on this a little bit more in a bit, but this is the average, about 50% of people within this 2-week time frame, but normal recovery may take up to 1 month, and I'll show some data on that here in a little bit. Moving on to impact biomechanics. So we've done a series of papers in high school athletes implementing sensors into the helmets that allow us to track the location and magnitude of impacts that they take. And really what we're seeing is that the average high school athlete takes about 450 impacts per season. And if you break this down, it's about 50 impacts per week for each one of these players. And this can be split out then into practice sessions and games where over 2 practice sessions per week, the average player will take about 12 or so in each of those sessions, 25 or so total, and then another 25 or so in the game. There's a fair amount of variance around this. We have data on one individual that took 4 or 5 impacts over the course of the season. This was a kicker. And then we have data on another individual that took about 1,000, 1,200 impacts over the course of the season. This was a lineman that played both offensive and defensive positions and had constant exposure, really never came out of the game at constant exposure. And so this just kind of, this was the first to really quantify how much exposure high school athletes were taking and trying to understand how that may set them up or not set them up for that matter for any sort of long-term risk. I think probably more importantly was our ability to identify the number of concussions and the amount of exposure that was going on relative to the preseason. And what we see is if we look at just the month of August, which accounts for about 20% of football participation across the season, this is where about 35% of the head impacts were occurring. So we see this disproportionate amount of head impact exposure occurring in the preseason timeframe. And probably more significantly, or definitely more significantly, is 50% of all the concussions were occurring during this time frame as well. So as we think about how do we make sports safer, identifying certain practice techniques that can be changed or can be eliminated to reduce head impact exposure ultimately allows or reduces the number of injuries that are occurring during the week, allows the coaches to field their best team on Friday night or on a Saturday, and then increasing their chances of winning and then obviously having a successful season. The other thing that we started looking at is this idea that there's a biomechanical threshold for concussion. The concept that if you hit somebody or somebody is hit with a certain amount of force in a specific location, then they will sustain it. It's automatically a concussion. And it turns out that's not the case. We have data showing concussions occurring at relatively low magnitude impacts, as well as individuals sustain very high magnitude impacts and don't have concussions. So working off of that initial data set, we started developing this idea around head impact density, where it's a combination of the frequency, how many impacts somebody is taking, the magnitude of those impacts, and then the time span over which those impacts are being sustained. And really what we were able to show, this figure on the right, on the darker lines, is that the cumulative frequency, magnitude, and shorter duration of time between impacts was substantially higher in individuals that ultimately sustained a concussion relative to matched participants that did not. And so what we believe is going on is the body, while there are changes that occur with each impact, and the body just isn't able to recover from those fast enough before the next one happens and ultimately results in the concussion occurring. The last thing I want to touch on is this are the acute effects. So what are the recovery trajectories that individuals have following concussion amongst various subgroups? These data come from the CARE Consortium, Concussion Assessment Research and Education Consortium, that was started in 2014. There's a lot of information here on the slides, but I'll just give you the highlights of it. We have 30 sites across the country that are participating in this study. We've been fortunate to enroll just under 55,000 individuals. These are NCAA college or NCAA student athletes and military service academy cadets, and capture about 5,000, a little over 5,000 concussions. We're now starting to gather information on these individuals at their time of graduation to have an understanding of how their cognitive functioning changes during their academic career, as well as another assessment that's occurring after they graduate, so we can start tracking what's happening to these individuals after they graduate, and starting to look at a longitudinal study to extend out 30, 40, 50 years to get an idea of potential for long-term effects. When we look at some of the data that we've already collected from it, when we look at the overall recovery of our student athletes that have sustained a concussion during the study, we see that the overall time to asymptomatic, so the time from injury until they no longer report concussion-related symptoms, is about a week. And then following a graduated return to play process, it's about another 6 days before they return to play. So this number is pretty consistent with what we see in the literature, around 2 weeks of recovery time for these individuals as the average, but it's really up to 1 month before the substantial majority of individuals are being returned to play. And starting to think about reframing what is normal recovery as 1 month, not necessarily 2 weeks, As individuals that currently, as they hit day 15, 16, 17, they start to believe that they have an abnormal recovery, which starts to cause psychological issues that overlay with injury recovery. We can also break our data down in recovery by sex, and our data here showing that our female athletes are recovering just a day or two slower than our female athletes. This is actually not statistically significant, but really starting to show that there don't appear to be differences here between our male-female cohorts, and so which is a little bit different than what we had seen in the literature. Lastly, looking at concussion history. So the idea that individuals with one concussion have longer recoveries relative to those with no injury. And our data here showing that it's not really until their individual shows up with 3 or more prior injuries that we start seeing this delayed recovery extending out about 2 days longer than those with 0, 1, or 2 prior injuries. Lastly, I just want to give a mention to some of the work we're starting to do here at Michigan at the Concussion Center, where we're integrating research, clinical care, and outreach engagement specialists to try to identify gaps in the literature and address those gaps in a way that will maximize clinical care for athletes, for military personnel, for just general population. Really to give the best treatments and then to allow people to return to their activities as quickly as possible. So thank you very much for your time. That was quite quick, but I appreciate your attention today. I want to recognize the funders and then the personnel in the center as well as in my lab that do the work. Without them, I would not be able to present. So I appreciate everything they do, and happy to take any questions at this time.
Thanks, Steve. That was a really great talk. We have a few questions coming into the chat. The first one is there any data to show that younger age at the first concussion has significant long-term consequences?
Yeah, great question, and something I think a lot of people are starting to ask, the implication of participating in contact collision sports, concussion, and long-term effects. Clearly, it's something that's gotten a lot of attention in the media over the last 10 years or so. We've done some work through the CARE Consortium, which I mentioned, looking at age of first exposure to injury, and then how athletes perform on a series of cognitive assessments once they get to college. And really, we see no difference between those that participated in contact collision sports and those that didn't, primarily through the middle school and high school years, and then relative to how they performed as collegiate athletes. But these are 18 to 20-year-old college athletes, so they're really at the front edge of the prime of their cognitive life. So how that looks 30, 40 years later, no one really knows at this point. It's something that we're trying to get a grasp on and starting to track these athletes long term. But right now, the data look pretty good that we're not seeing these issues.
Wow, interesting, very interesting. We have a question from a radiologist asking what imaging options can they offer to referring docs? Are you finding any specific MR sequences are helpful or specific imaging options?
Yeah, so I think one of the things, so radiologists is going to know this, I think, but just broadly, I think one of the misnomers that we hear quite often is that someone will go into the ED and a scan, typically a scan is ordered, a CT scan, and comes back negative, just indicating no bleed. And they're kind of, the feeling is like we're in the clear, but there is no imaging sequence, even research-based sequences that can diagnose concussion. So the work that we're really starting to focus in on is the DTI work, and showing really that mean diffusivity and the magnitude of that is actually a predictor of recovery. So you get not only the ability to start to differentiate concussed from non-concussed, but also starting to be able to predict how long the recovery process is going to take. But that's research-based at this point. We're years and years, if not decades, away from being able to use that clinically from a diagnostic and prognostic manner. But I think it'll be coming in short order.
Great, that's great information. There's another question coming in about, have you seen and what are sort of the long-term issues that you see with teenagers after two back-to-back concussions? So I think around second impact syndrome.
Yeah, well, so around second impact syndrome. So for those who don't know, the second impact syndrome is having one injury and then the athlete returning to play before that first injury is recovered and they sustain a second injury. And it's not really clear why it happens, but there becomes this a mismatch in the auto regulation of brain pressure. So you get a massive amount of brain swelling. The brain herniates out through the foramen magnum to where the brainstem exits the skull, and really starts compressing some of the vital functions of the brain, and has unfortunately a very high mortality rate. It's quite sad. On the other side of that, it's quite rare. We see it probably a handful of times a year across the country. And of course, every one of those cases is tragic. I'm not trying to minimize, but it is a rare occurrence. And we just really don't have an understanding as to why it happens. It does seem to be limited to adolescents and teenagers. We don't see it in adults for some reason. We just don't have a good grasp on why it occurs, but it's out there, and it does happen every year.
Mm-hmm. Really important. Thank you for that update. I think the last question here, as we wrap up, to what extent are the findings that you talk about be able to be extrapolated to non-sports related head injuries?
Yeah, it's a great question. So I think one of the beauties of doing this type of work in a sporting context is, we have a captured population with a pretty well-defined injury rate. We can get pre-morbid data on these individuals. We do baseline testing and use that almost as their own controls. A lot of times we'll bring in non-injured athletes as controls as well. But the question is very poignant. Like, how well does this work to somebody that slips on the ice, or they're in an automobile accident? Biomechanically, I'm of the opinion that force to the head is force to the head, and so there's really no difference with equivalent forces in the biological portion of the injury. What gets tricky is the psychological or what we call the psychosocial aspect of the injury. And so motor vehicle accidents or slips, trips, and falls often involve litigation, which brings in a certain component to it. How strongly an individual identifies is removed from certain aspects of their life, whether they're removed from school or removed from work, can bring in social and psychological aspects to it. So I think there are certain things we can take from the sporting role and apply to other contexts, but we need to be sure that as we are applying these things, that we understand how they're being applied and what the limitations are, and making sure that we're looking at the whole person and not just the biology.
Really important. Thank you for making that point. So I just want to highlight the great work of the Concussion Center and appreciate all of your input into the work that we have going on here in concussion prevention at the University of Michigan Injury Prevention Center. And thank you for your presentation. It was really great.
My pleasure, Pat. And I would be remiss to say if I got my start at the Injury Prevention Center here, and we are a spinoff from you guys. So thank you for the foundational work that you allowed me to do. And we're pretty excited to get our center off the ground.
Absolutely.